Okay, for the anterior leg, we're going to start at the bottom, work our way up. So we're going to start with the tib anterior, which is the kind of the shin muscles, the outside of your shin right here. Okay, so what you're going to do is you're going to place the foam roller right underneath that. And you're just going to kind of roll all the way up the knee, all the way down the ankle. Okay? And as you do that, if you find an exquisitely tender part of the muscle, you're going to sit on it for about 5 seconds. Okay? So 10 to 12 passes, and then we move on to the quad. So the quad, or the upper thigh, there's a couple parts. There's the lateral, the middle, and the medial, kind of like there is with the calf. So what we're going to do is we're going to get down in position. We're going to start with the medial part. So kind of roll your leg out like a frog leg. Kind of sit on it, and you're going to roll 10 to 12 passes. And you'll find if you find a really exquisitely tender point, you sit on it for about 5 seconds, and then roll through. All right, then you roll over to the middle. Same type of thing, all the way up, all the way down, 10 to 12 passes. All right, roll to the lateral. Now this isn't the IT band, we're going to get to the IT band in a second. This is just the lateral quad, lateral thigh. So the difference is, the lateral quad muscle goes right about here. The IT band is more lateral, kind of like the seam of your pants would run. So we're going to show you how to do that now. Now the interesting thing about the IT band is you have to roll the TFO, which is the tensorofasciolata muscle, and the IT band. So you got to make sure you go all the way up into the hip. So once you come down here, place that muscle right on it. You're going to roll right down it and twist as you come up. So all the way up on the muscle, all the way down to the knee. 10 to 12 passes. If you find a tender spot, probably up in that tensorofasciolata muscle, I want you to sit on that. Just kind of sit for a second, 5 seconds, and then roll through. Good. So remember, there's the IT band, or sorry, the tibialis anterior. There's the quad muscles, 3 parts, and there's the lateral TFL. Okay, so now what we're going to do, we're going to do the upper back and lower back. And I'm going to use a bigger foam roller for this one. I'm going to use the big black one. So what you want to do is now with the lumbar spine, when you start working on the low back, you don't want to hyperextend your low back. So you don't want to put it in your low back and then bend over it. It's hard on your low back. So what you're going to have to do, you're going to keep a little bit of curve in your low back while you're doing it. So you kind of keep curved up like this, kind of like you're doing a little bit of a crunch. Then what you're going to do is you're going to roll over on the side just a little bit so you get those muscles. You're going to roll back and forth. 10 to 12 passes. If you find a really exquisitely tender spot, you sit on it. And roll through. Okay? Then you're going to get the other side. Okay? So that's the lumbar spine. You can actually roll straight up and down on it, but you got to keep that flexion in there. So if you hyperextend your back, that can irritate low back problems. Next thing we're going to do is we're going to do some foam rolling for the upper back. This is great for office workers, people that have kind of a rolled upper back. This is one you can actually hyperextend on and be good with yourself. If you lean back, have your head back a little bit, lift your butt up a little bit. So foam roller's kind of right between your shoulder blades. Lift up, put your hands behind your back, head, and roll back and forth. Okay. You're going to do about 10 to 12 passes. If you hear something popping and cracking, it's okay, because it's just releasing some stuff. Just keep breathing while you're doing it. 10 to 12 passes at least. Good. Then what we're going to do is we're going to foam roll the lat. Kind of the latissimus dorsi muscle, which is usually tight in most people. So what you're going to do is you're going to start kind of cockeyed with your arm out to the side. You're going to roll up, and roll back, then roll up. 10 to 12 passes. Usually it's most tender for most people, right up underneath the armpit there. All right, 10 to 12 passes. If you find an exquisitely tender point, you're going to stop, sit on it for about 5 seconds, and then roll through. So that's foam rolling for the back. Again, I'm Dr. Jason Schlenker, westlandchiro.com, 503-908-0582. Thank you.